Hi, Mr. Jones. My name's Mary. I'm going to be your nurse today. How are you feeling?
Good.
Okay. I checked your chart and you were scheduled for a wound dressing change today. So I was going to go ahead and move forward with that. First, I want to check your name or your ID bank. Can you tell me your name and date of birth?
Bob Jones, 10-10-1950.
Great. And Mr. Jones, are you in any pain right now?
No.
Okay. Is it okay if I move ahead with the dressing change?
Yes.
Okay. So I'm going to raise your back to a comfortable working height. I've already provided privacy with my curtain. I carried in my supplies earlier. Arrange my tables. So I'm going to have 2 tables right there. Situate my garbage can within reach. Now I move my table so that I don't turn my back on my sterile field. So my sterile field is going to be here. The supplies I'm going to need moving forward are going to need clean gloves to remove the old dressing. I'm going to need a sterile drape. I'm going to need sterile gloves. I'm going to need ointment to apply. I'm going to need swabs to apply the ointment. I'll need my 4x4s, a sterile ABD dressing, and then my tape. Okay? Okay. You okay, Mr. Jones?
Yep.
Mr. Jones, I'm going to fold down your blanket slightly. I'm going to pull up your gown just to expose the dressing area. You have a surgical wound that's on your abdomen. Okay, I'm going to go ahead and remove the old dressing using the push-pull method. The reason we're doing that is we want to avoid skin injury from removing the medical device. So I'm going to hold the skin and pull back and then work around. Okay. Lift the old dressing. Okay. In this dressing, I'm going to assess for the drainage on here, and I'm going to look for the type, amount, color, and odor. The acronym TACO can be used. I don't see any drainage right now, so I'm going to discard the old dressing. I'm going to assess the site itself. He does have a drain, a Penrose drain to the left, and then his surgical incision is closed with staples. It's approximated, it's not dehisced, I don't see anything eviscerated. There is slight redness or erythema around the site. I don't see any active draining on the site or on the skin. So I'm going to take my tape measure and measure the length of the wound. And I have 7 centimeters, and we would just want to make sure and check the previous measurement to make sure that it is not extending any further than the original incision. Okay? So throw in my tape measure. Okay, so now I'm going to leave the wound open right there, and I'm going to set up for my sterile dressing change. Tail my tape. So I'm going to need 5 pieces of tape, 2 short. You only want to do as much as to frame the ABD pad. 2 longer. And then I'm going to do 1 short one to write the date, time, and initials, and that's going to go on the corner of the dressing once I get it placed. Okay, so now I am going to set up my sterile field. So the supplies I need are sterile drape, sterile ABD pad, the medication to put on the wound, the swab to apply the medication, my sterile gloves, and then a package of sterile 4x4s. And then I brought another swab just in case the first one falls off the field. Sometimes those are difficult to open. Okay, so the first thing you want to do is open your sterile drape. Again, make sure that your garbage is within good reach. Okay, so when you open your sterile drape, you want to grab it by the corner. Pull it out. Drop the garbage. So there should be a blue side and a white side to your drape. You want to make sure it's not touching your table. You can touch the edge. The 1-inch border is not sterile, so the blue side's going to go down. So you drop that on your table, and nothing should hang off your table because then that's considered not sterile or contaminated. The next thing I'm going to open is my AED pad. Anytime you're dropping anything on your field, you want to stay 6 inches above. You never want to turn your back on your field. You open away from you and let it fall. Again, I'm going to open my sterile 4x4s. I'm going to open away from you. So with the opening, it's like Pac-Man to the field. And then drop. The swabs. One more just in case.
Talk a little louder.
In my ointment, whenever you're doing something, this is a non-sterile package, you want to drop it like not 1 inch to the edge. You have to go in a little bit further than that, so maybe 2 inches from the edge. You just drop a little amount of the medication. Okay, so I think that is all the supplies I need. So now I'm going to don my sterile gloves. And again, I cannot turn my back on my field. And I want to address my patient. Mr. Jones, are you still doing okay?
Yep.
Seems to be doing okay. So I checked the integrity of my packaging, and it is good. It's the correct size. Fingers away, cuff towards you. Okay. This one has a top cuff and a bottom cuff, so I'm going to do the top cuff first. And the bottom cuff. Give it a tug so it'll stay. So my non-dominant hand, I'm going to pinch and glove my dominant hand first. First they're stuck together.
Okay.
Alright. So now I'm going to scoop. Okay. So now I can arrange my supplies. So I'm going to separate 2 gauze so that later if I touch the body I don't have to come back to my field with 2 hands. I'm going to open up the ABD pad, and when you apply it, the blue line should be out, not toward the patient. And I have my swab. Okay, so Mr. Jones, I'm going to go ahead and put some medication on your wound. So dip that in the medication. I'm going to go down the center of the wound. Now I'm going to drop. And again, my hands can't go below my waist or below my table because then they would not be sterile. So I'm going to pick up my sterile gauze. Apply it. Pick up my more sterile gauze. Apply it. My ABD. Okay, so now I'm going to sit you. Make sure you take my long piece. Far side. And then the piece with my daytime and initials, I'm going to the corner. So you don't want to block in case it did start draining. You don't want that piece of tape blocking what you can see. Okay, Mr. Jones, you doing okay?
Mm-hmm.
Great. Okay, so I'm going to cover Mr. Jones back up. Okay, I'm going to discard. Put his table back because I believe he had this table. I'm going to roll his bed back down. Gotta make sure his call light is when you reach. I will come back at least once a shift to check on the dressing. Okay. Is there anything else you need, Mr. Jones?
Nope.
Okay, I'll be back in a little bit to check on you.
Thank you.